Hi, my name is Celina Egemasi, and I'm going to go ahead and perform the head, ears, eyes, and nose and throat exam. I've already washed my hands. I'm going to introduce myself to the patient, and I'm going to ask her for her name. Hello, I'm Celina. I'm going to be doing your head, ears, eyes, nose, and throat exam. What is your name?
Stacy Uzin.
All right, Stacy. I'm going to go ahead and inspect your head and your neck. What I'm looking for is the color throughout your head and your neck. There's no sunspots noted, no deviation, no drooping or facial drooping. Looks like your nose is midline to your face. Your eyebrows is also midline and evenly distributed. Her eyelashes are evenly distributed. No, her eyelashes not showing any kind of loose hairs or anything noted. Her mouth is evenly symmetrical to her face. Her neck as well. Go ahead and tilt your neck. I'm looking at her trachea. No bulging, no lymph nodes noted. It's smooth and firm. Okay. Alright, so the next thing I'm going to do is I want to palpate her sinuses. I'm going to use my two fingers and I'm going to palpate her frontal, her maxillary. Any tenderness?
No.
I don't feel any lymph nodes either as I'm doing that. I'm going to palpate her periocular sinuses, which is in front of her ear, right here. Any pain?
Mm-mm.
No lymph nodes noted either as I'm palpating. Her posterior, which is behind her ear, sinuses. Any pain?
Mm-mm.
Alright, and no lymph nodes noted as well as I'm palpating. I'm going to palpate her supraclavicular. No lymph nodes, no deviation noted. Any pain as I'm doing that? Alright, so I'm going to also look at her thyroid. Use my three fingers. Alright, and with the thyroid, you're looking for firmness, smoothness, pliable, non-tenderness, and free of nodules. Any pain?
Mm-mm.
Alright, so the thyroid is midline and not deviated. Alright. As I'm looking at her neck, I'm looking for the carotid artery to make sure it's not bulging. And I don't see any bulginess. It's not distended. Her vein is not distended either. The next thing I'm going to do is have her swallow some water. Alright, so as you sip the water, please hold it and then I'll let you know when to swallow it. What I'm going to do is I'm going to check to make sure her trachea doesn't deviate when she swallows. Go ahead and swallow. Everything is midline. Was there any pain when you swallowed? Any difficulty? Okay, the swallowing test she did pass. There's no cough when she swallowed either. The next thing I'm going to do is going to assess her temporal mandibular joint, which is right here, close to her jaw area, her neck. I'm going to ask her to open up her mouth, open up your mouth, and then close. I didn't feel any crepitus, no deviation, everything was midline. Was there any pain?
No.
Okay. So next thing I'm going to do is go ahead to auscultate her thyroid and also her temporal. What I'm looking for is for bruise. There was no bruise noted. I'm going to also listen for her temporal arteries. And there was no bruise noted there either. The next thing I'm about to do is I'm going to inspect her eyes. Right now I'm looking at to make sure there's no drooping in her eyes. I'm inspecting the color. The eyelashes is evenly distributed. I'm also going to look in her conjunctiva. They're pink. There's no drainage noted. Her square is white. Okay. I'm going to use a ophthalmoscope to inspect the corneal reflex in her eye and the retinal reflex as well. There is a retinal reflex to the left eye. And there's also one noted to the right eye. Alright. Okay, so the next thing I'm going to do is going to look at the optic disc. Alright, the optic disc is yellow. There's no lesions noted. The optic disc on the other eye is yellow and there's no lesions noted. I'm going to go ahead and inspect the macular. I'm going to ask the patient to look directly into the light. Look directly into the light. Okay, I do see the dot of the macular. There's no lesions and there's no yellowing. Okay. So the next thing I'm about to do, I'm going to use my otoscope. And I'm going to check for constriction. Look directly. Her left eye does constrict as it reacts to light, and so does the other eye, but it doesn't constrict as much. I'm going to do the same for on the other side to her right eye. The right eye is constricting as her left eye is constricting just a little bit. So I'm going to do the cardinal signs right now. I'm going to have her to look at my finger, make sure she's able to look at it midline, which she is. And I'm going to ask her to follow my finger. Follow my finger as it moves. Alright. She did well on that test. So the next thing I'm about to do is I'm going to have my patient read the Snelling chart to look at her visual acuity. She's going to stand at 20 feet away from the chart. And we're going to start at the 20/20 vision. I'm going to ask her to cover her left eye first. Alright.
DEFPO2EC LEFODFTC.
Alright, so go ahead and cover the other eye. Start from here.
DEFPOTEC LEFODPCT FDPLTCEO.
So it looks like her left eye is much better than her right eye, even though her right eye still has good vision. Her right eye is 20/20 while her left eye is 20/13, which is also good. The next thing I'm going to test right now, look at and inspect and palpate is her ears, nose, and throat. So the first thing we're going to look at is her ears. I'm looking at the color to make sure the color is even on both sides. I'm going to use my imaginary line, make sure that it's 10-degree angle from her eyes right here, the horizontal line. And it is. There's no trauma noted. I'm feeling the ears, no lesions. Good. At this time, if I had a tuning fork, I would put it right here on top of her head to listen, to test her auditory. And also, I'll put it right here behind her mastoid bone and listen, and have her tell me when she stops hearing the vibration. Right now, I'm going to go ahead and inspect the inside of her ear using the otoscope here. I'm going to pull her ear back right here and up. I'm looking into her tympanic membrane. It's pearly gray. I'm sorry. I'm looking into her tympanic membrane. It's pearly gray. There's no serum noted. No lesions. Okay. I'm sorry. What's that doing? Okay. And so I'm going to pull her ear back and up. Okay. The tympanic member is pearly gray. No drainage. No cerumen noted. The hair is right there at the outer part of her inner ear, and it's not inside of her ear. So the next thing I'm about to do is I'm going to look inside her nose, her ears, using the otoscope. There's no trauma, no bleeding, no drainage. It's pink. There's no redness noted. So evenly, the hair is at the outermost area, evenly distributed. Good. So the next thing I'm going to look at is her mouth. I'm looking at the color of her mouth. Go ahead and open up your mouth. Ah. I'm going to use the otoscope again to look through. To look at her uvula to make sure it bounces up when she says ah. Say ah again. Alright, good. There's no trauma noted, no lesions in her mouth noted. It's all pink. I'm going to use my tongue blade to inspect the mucosa. I'm going to put it on the side. The mucosa, there's no grayness or cyanosis noted. It's all pink, no drainage, no trauma, no bleeding. Her teeth looks like it's equal and strong. There's no loose teeth noted. Smile for me. Okay, I'm going between her teeth with the tongue blade. It's strong. There's no loose teeth noted. Just good. Her gums. Okay, the gums are clean. There's no odor. It's pink. Good. So far, I have finished conducting the head, ears, eyes, nose, throat exam. Thank you so much.